Hi students, today let us discuss about a clinico social discussion over the case of hypertension. So let us present a case. So 52-year-old male Mr. Bhaskar from Perumal Koil Street of Nagapatnam, who is auto driver by occupation, having an education qualification up to 5th class, Hindu by religion, and he is about upper class according to modified BG Prasad scale. So talking about the chief complaints, he is having nasal bleeding from the left nose for the past 1 hour. So talking about history of presenting illness. So whenever you present about hypertension, you need to know about what you should ask regarding hypertension. So whenever it is about hypertension, you need to have you need to ask the patient with respect to all these 6 features. First one is headache, onset, duration, progression, and aggravating factor and relieving factor. All those things you have to ask. And you should ask about period edema, whether it is pitting edema or non-pitting edema, onset, duration, aggravating and relieving factor. We should ask about difficulty in breathing, and we should ask about palpitations. We should ask about vision problem, nasal bleeding, and onset, which side it is unilateral or bilateral, continuous or occasional bleeding, any history of trauma associated. All those things you have to ask. And you to rule out visual acuity, blurring of vision, and you need to ask about chest pain, which side, which character of pain, whether it is radiating pain or not, like that you have to ask. And also you need to ask about generalized weakness and apathy, because one of the main feature or one of the main complication of hypertension is stroke. So you need to rule out all these features. So your history of presenting illness should have all these complaints. So let us discuss whether it is present or not. As he said, the first thing you have to include is nose bleeding. So epistaxis is nose bleeding. So you should ask about onset, progression, duration, aggravating factor, and relieving factor. All those things has been asked. And headache, giddiness, bilateral period edema, vomiting, breathlessness, chest pain, palpitations, hematuria, puffiness of face, and visual acuity. All those things, abdominal pain, seizures, confusions, all those things, the presenting illness has been included. Talking about the past history, you need to say whether it is the already diagnosed hypertension case or not, and you need to ask the other features like TB, asthma, diabetes mellitus, coronary artery disease, thyroid disorders, and all those things you have to ask, and you have to mention in the history. Talking about the treatment history, you need to ask about the patient. You need to ask whatever drugs they are taking, and if possible, you can check over the tablets, and you need to mention the dosage also. Talking about the personal history, you need to ask about diet, you need to ask about sleep, you need to ask about other features like bowel, bladder movements, you need to ask about smoking history, and you need to add about pack years. What is pack years? Which is nothing but the pack years is if he is taking 2 packs. In this case, you can see he is taking 2 packs per day, and he is a smoker for 26 years. So if he is a smoker for 26 years, you need to multiply it with number of packs into number of years. So that gives your pack years. You need to calculate pack years, and if possible, you can also calculate smoking index, which is also very good to calculate. Talking about alcohol intake, you need to check out with what type of alcohol has been took by the patient, and the amount of alcohol that has been taken by the patient, or it should also be included. And marital history can also be included in the personal history. Talking about diet history, you need to add about what type of dietary surveillance method you have included. For example, it is based on 24-hour recall method, or food questionnaire method, or raw food processing method. Like that, there are several methods in the dietary surveillance. You need to clear out what method you are focusing, and you need to mention that based on this in this history, we are taking with respect to 24-hour recall method. So we have to mention that in this case it has not been mentioned, but in real case you need to mention it. And afterwards you need to add up with all those stuffs like morning what was taken, evening what was taken, like that you have to add. Normally you should need to remember some of the things. For idli, you need to remember one idli, it is 75, I guess. So 75 calories are needed to consume one idli, and 1 cup of tea is averagely it will be 75 kilocalories. It is strongly mentioned here, so avoid it. 1 cup of rice is 170 kilocalories. 1 cup of sambar is 110 kilocalorie. All those things you have to add up. So based on that, you should calculate diet history. And talking about age-wise deduction in the calorie requirement, that I will discuss in the next case sheet. So do follow in that. That will be discussed in a separate video or in another video. But sure, if mentioned, I will be adding in the thumbnail. You just follow our thumbnail, and let me mention that in the next video. Talking about family history, you should you should need to add first general family history, like there is no significant family history like that, or if any family history is present, like any genetic complications are there, you need to mention that. And afterwards, you need to mention about all the family members that are present over in the family, and their age, the occupation, and their income. All you should need to mention it first. And afterwards you need to put modified Kuppasamy scale and modified BG Prasad scale. Normally in BG Prasad scale you need to remember one thing. So B for BG Prasad scale. So both rural and urban areas BG Prasad scale can be used, but modified Kuppasamy scale is used only for urban. And also BG Prasad, P for per capita income, P for Prasad. So BG Prasad scale is used for by calculating per capita income. So you need to remember this one. Okay, so So I am discussing very gross ideas. I will be discussing it very detail after sometimes. But remember, whenever you are talking about hypertension, you need to write these stuffs. Afterwards, environmental history. Talking about environmental history, you need to say with external environment and internal environment. External environment, you should add first locality, and you should need to go with respect to SEDAC area. You need to go with any drainage, water drainage supply, or water stagnation is present, any insect breeding is present, and any stray animals and pet animals are present. Like that, you have to mention it. And afterwards, talking about internal environment, you need to first go with respect to hall, any wall, roof, what type of house, and any crack and crevices are present, any insect breeding is present, separate kitchen is present, separate bathroom is present or not, a number of living rooms is present, overcrowding is present or not, cross ventilation is present or cross ventilation present or not, lighting is present or not. All those stuffs you need to add. Talking about kitchen, what type of fuel is used, what type of stove is used, any vessels are completely covered or not, and storage of cooked food in what type, smoking vent is present or not. All those stuffs you need to add. Talking about water supply, what type of water supply, any municipality water supply or bored water, all those things you need to add up. And how the water is purified, that one also you should need to add up. And talking about waste disposal, any septic tank is present or not, sewage, sillage, how it is disposed, all those things you need to add up. And you need to add up a summary. This summary, which is very very important. Normally in general viva, in the case presentation times, there might not be patient for the examiner to completely ponder over the case whatever you have taken. So instead what they will do is, they will ask you to directly present the summary, and it is important that you need to present the summary very well. So while you are writing summary, you need to add up, you need to remember some things. In clinico-social diagnosis, you need to add up first 4 lines of the intro. What is that means? The age, the name, and what is the address, and what is the occupation he is belonging, and what type of scale and what class that you need to mention. And after that, what is the diagnosis and what is the significant past histories and significant present histories you can add, like nose bleeding is present and he is a known case of hypertension, like that you need to add, and how much treatment that you can add. So since that is a significant history, you can add, and after that you need to add up the environmental history part. So it is very very important that you need to add all those things, since environmental history and the past and present history, some part essence is important, and above the occupation and what class does the person belongs, that is very important. So in summary, you need to present that in a very concise manner. Talking about general examination, all those things you need to write typical, and anthropometry you should add, and vitals you need to put. Normally temperature you need to measure and put, don't add a word like afebrile, so that is not ideally recommended. And talking about system examination, you need to perform all 4 steps: CVS, RS, abdomen, and CNS. So in CVS, in blood pressure, you need to ponder more over CVS, as in CVS regarding inspection, you need to check out tracheal position, you need to check over the chest symmetry, you need to check for any thrill, any palpable, any visible murmur, bilaterally symmetrical elliptical chest, and apical impulse is seen or not, any abdominal pulsation is seen or not, that you can observe with respect to inspection. Talking about palpation, in palpation you need to check any, you need to confirm the inspectory findings, you need to check over palpable murmur, thrill, parasternal heave or parasternal heave is present or not, all those things, and you need to mention the position of apical impulse, which is present over the 5th intercostal space, half an inch medial to the mid-clavicular line. That you need to add. Regarding percussion, you need to percuss the border of the heart and whether it is present in the normal limit or not. Talking about auscultation, you need to auscultate for S1, S2, and you need to remember that any murmur, you should add a word murmur, about murmur you need to add a thing. Talking about the clinico-social diagnosis, so the clinico-social diagnosis based upon the inspectory findings. So in the clinical social diagnosis, you need to add up some word regarding investigations, prevention, and program, all those things. So in investigation, you already know you should need to add about check blood pressure monitoring, blood sugar levels, RFT, ECG, and general examinations, fundus examination you need to add. In prevention, as mentioned, you need to put about DASH diet, weight reduction, and exercise promotion. Secondary prevention includes early diagnosis and treatment. Tertiary includes regular checkup and compliance. So this is about the clinical social presentation of hypertension, but you need to remember some stuff other than the hypertension, since your clinical social presentations will be followed always with respect to viva.